Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
All right, welcome, bitches, to the Transformation Nurse Academy podcast. This is Kevin, and I'm your fucking favorite ER nurse. Maybe, I don't know, who gives a shit. But I want you to know that we're going to be talking today about the Pediatric ESI Triage Tool. Last week, we talked about the adult version. This week, we're going to talk about the pediatric version. So welcome again. We're going to provide you some valuable information to help you navigate the healthcare system. I'm your host, Kevin. And today we'll be discussing the Pediatric Emergency Severity Index Score, or the ESI triage system. So whether you're a healthcare professional, a parent, a caregiver, this episode will help you understand and what to expect during your pediatric ED visit and how the ESI score impacts your care of your child. So if you don't know what that is, there's a free book that I created. It's an ebook like I did the adult version. Jane will put that in our links and we'll post it on our Facebook page, our Instagram page, TikTok, all that shit. And you can download it for free. It'll only be free for a certain time. And then we're going to start charging for it. Not a whole lot, maybe $5 or $6, but still it's free right now. So make sure you get your copy. All right. So we're going to introduce you to the Pediatric ESI Triage Tool. So let's start with a brief overview of what happens when a child arrives at the emergency department. The ESI system is used to prioritize patients based upon the severity of their condition and the resources they need. The system helps ensure that the sickest child or the sickest children are seen first. So we do use something in ED patients. We call it the Pediatric Assessment Triangle. It is your work of breathing, your appearance, and your skin color or your circulation. So we do use that as our rapid evaluation when we're evaluating children, but we also use the Pediatric ESI Triage Tool as well. The ESI system categorizes pediatric patients in 5 levels, just like the adults. ESI 1 indicates a child who needs immediate life-saving intervention, such as a child in cardiac arrest. If you don't know what cardiac arrest means, I have to say the word unalive because TikTok and Facebook and all you motherfuckers are too simple to fucking use the right word. ESI 2 includes children that are at high risk or in severe pain, such as those with severe asthma attacks. ESI 3 patients need multiple resources like blood tests and imaging, but their vital signs are stable. ESI 4 patients need one resource like an X-ray. In ESI 5, patients do not need any immediate resources, such as those with minor injuries. You know, like the Band-Aid and the boo-boo. And, you know, the parents don't know what they do because it's their first fucking kid. Not judging. Been there before. I got 6 fucking kids. All right. So initial pediatric patient assessment. A key part of the triage process is the initial assessment, in which we do use also, like I said, the Pediatric Assessment Triangle, and we'll discuss that as well. For children, this includes asking specific questions about their symptoms and taking vital sign measurements, recognizing critical conditions quickly, because children have a hard time compensating, and they compensate for a while, but then all of a sudden they go boop, and that's it. So you got to make sure that when you're paying attention to the pediatric patient, you don't take your time, and you make sure that you pay attention to the key signs. And so we'll talk about some of those key signs as well. All right. So just keep that in mind when you're doing your Pediatric Assessment Triangle and your ESI triage. But don't use your emotions, use facts and figures. All right. And I'll show you. I created a Pediatric ESI Triage Tool like I did for the adults. So using the ESI algorithm to classify pediatric patients accurately is essential. And we'll go through the quick guide that I created for you. And it's free online. You can go to morethancpr.com/pediatric-ed-triage. And it's a free tool that you can use. And I encourage you to use it. So let's discuss some of the common pediatric scenarios and their corresponding ESI levels. For example, a child with a fever and lethargy must be or might be classified as an ESI 2, while a child with a minor cut could be classified as an ESI 5. So we want to make sure that we're communicating these triage decisions to the children and their families. And it can be challenging. And we'll talk about some ways that you can have techniques in the book. We talk about ways that you can communicate to the kids and to the families as well. All right. We'll look at some real life scenarios. We'll talk about some pitfalls and things like that. All right. So I'm going to open up my book, my e guide there. And I got the table of contents. We have the introduction to the pediatric ESI triage. We got key differences between adult and pediatric triage, understanding the ESI levels for pediatric patients, pediatric decision making algorithms, some common pediatric scenarios and ESI levels, key principles of pediatric communication, pediatric case studies, and common pitfalls. So this is all in the ebook. All right. So just remember the Emergency Severity Index triage system is a vital tool used in the emergency department across the world to ensure that patients receive timely and appropriate care. The pediatric ESI triage is an adaptation of ESI systems specifically tailored to address the unique needs of children. The system categorizes pediatric patients into 5 levels, like we said, 1 to 5, based upon the urgency of their medical conditions and the resources required for their care. Why is pediatric triage important? Because timely care for critical ill children, especially infants and toddlers, they can deteriorate rapidly. An accurate and efficient triage systems helps identify those in need with immediate intervention. You want to make sure you optimize resource allocation because we don't want to waste resources. We want to improve outcomes. And we want to make sure that the family's reassured, providing clear information about the triage process and what is expected and the timeline it is expected in, and how we can help relieve the anxiety for the caregivers, the health caregivers, and the patients as well. So, some key differences. Physiological difference, children have different normal range of vital signs compared to adults. So when you do vital signs for kids, you should break it down into 3 categories: neonates, infants, and children. A neonate is 0 days to 28 days. An infant is 29 days to 1 year, and a child is anything over 1 year. Communication challenges. Younger children may not be able to articulate their symptoms like you and I do. So if they have an anaphylactic reaction, allergic reaction, they may say, I got an itchy tongue, or they even may say, I got chest pain or my belly hurts. That could be an allergic reaction of some sort. Pediatric triage, your nurses and doctors must rely on observation more and parental reports more than you do with adults, because you got to look for those physical cues, the psychological cues as well. The development considerations, developmental stages affect how children respond to illness and injury. And understanding these stages helps healthcare providers tailor the approach to the child's development level. All right, so we want to have a rapid identification. We want to have appropriate classification. We want efficient utilization of all the resources. All right, so when you go through the book, make sure you read carefully, because each thing will help you with the children that you are triaging, or the pediatric patients. So, like ESI level 1, immediate life-saving intervention required. Children classified as ESI 1 are experiencing life-threatening conditions that require immediate medical intervention to prevent death. So it could be severe traumas, could be cardiac arrest, it could be severe respiratory distress. So when we talk about respiratory distress versus respiratory failure, I'm just simplifying it so all you fucking nuts out there don't get crazy. But an easy way to remember this is increased effort and increased rate is like distress, and decreased effort and decreased rate is respiratory failure. Children in distress, if you don't take care of them, are going to go into failure. And if they go into failure, they're going to go see Jesus or Guru Nanak or where the fuck you believe it. Active seizures, not responding to initial treatment, is considered an ESI 1, for example, and severe anaphylaxis with airway compromise. So those are some examples of ESI 1. ESI 2, children who are at high risk for significant deterioration or experiencing severe pain. These patients need to be seen promptly, but do not require the same immediate life-saving interventions. So, for example, severe asthma exacerbation with difficulty breathing, high fever with altered mental status, suspected sepsis with abnormal vital signs, or severe abdominal pain with possible appendicitis. That could be some examples of ESI 2. ESI 3 needing multiple resources, but their vital signs are stable. So ESI patients require multiple resources to treat their conditions, but they're currently stable and not in immediate deterioration or danger. So some examples would be moderate dehydration requiring IV fluids and lab tests, non-severe asthma exacerbation needing some nebulizing treatments and maybe a chest x-ray, minor trauma requiring x-rays and suture. So those are some examples of ESI 3. ESI 4, one resource needed. A patient only needs one resource to address their condition, and their cases are less severe and usually involve straightforward diagnostic or therapeutic intervention. So, for example, if you have a simple fracture requiring a x-ray and splinting, laceration needing sutures, earache requiring examination and antibiotics, those are some examples of ESI 4. And in ESI 5, they don't require any immediate resources and can be managed with minimal intervention. So, abrasions, bruises, colds, routine medication checkups. So, those are some examples. All right. So, I'm going to share my screen. First, we're going to talk about the Pediatric Assessment Triangle. So, let me share my screen here. Let me see where we at. Share screen. Share my screen for you. All right, here we go. So we want to talk about the pediatric assessment triangle. We have appearance, worker breathing, skin circulation. So when it comes to appearance, what we're talking about is abnormal tone, decreased interactiveness, decreased consolability, abnormal look, gaze, abnormal speech or cry. So you got to break it down into neonates, infants, and children. So what is the normal tone? And they don't mean the skin tone, they mean muscle tone. So if you have a neonate that comes out of their mama's vagina, it should be screaming, crying, moving around. But if it's all floppy, that is not normal tone. Your butt cheeks should pucker. If the baby's crying, moving around, screaming and hollering, the parent should be able to pick it up, or you should be able to pick it up and console it. If you can't console the baby, then there's something going on that you should pay attention to. Worker breathing, abnormal sounds. So when we talk about sounds, you have upper airway. If you see on the screen, this is your upper airway, Vogan and shit. Lower airway. So upper airway would be your nasopharynx, your oropharynx, your larynx, your pharynx, your epiglottis, those things like that up in the upper airway. And if you have an upper airway obstruction, you would have inspiratory stridor. Lower airways, your trachea, your bronchus, your bronchi, your bronchioles. And the sounds that you would hear would be expiratory wheezes. And then you got lung tissue disease, which would be like pneumonia, and you would have crackles, coarse rhonchi, whatever fucking word you want to use. And then the last one is grunting. So when a child is grunting, if you put your hand on your belly and you try to take a shit and you push it, that means you're increasing this pressure in your abdominal and your thoracic cavity. And that is a form of autopeep. That means your child is trying to create PEEP to keep their alveoli open. So when they talk about abnormal sounds, they're talking about stridor, they're talking about wheezes, they're talking about crackles, they're talking about grunting. Abnormal position, are they tripoding? Retractions, are they using their abdominal accessory muscles or their intercostal muscles? Are the nose flaring? Do they have tracheal tugging right around the suprasternal notch? You're looking for tracheal tugging. Are they gasping? That's what they're talking about, worker breathing. Skin circulation, they're talking about pallor, modeling, cyanosis. Pallor, you're fucking pale. Modeling, you're a little bit splotchy. You know, that got these red and bluish kind of dots. And in cyanosis, your fucking patient's turning blue. That's what they mean by using the pediatric assessment triangle. So, share my screen again. I'm going to show you my pediatric assessment triangle tool. So, this is my tool here. So, I have it broken down where in the age you can do years, months, and days. So, you know, we have neonates, 0 days to 28 days. I'm going to put 20 days. And then it says, is the patient experiencing any life conditions such as severe trauma, cardiac arrest? I'm going to select yes. And you can see that it automatically puts the child at ESI level 1. All right, so I'm going to reset that back. We'll go back to 20 days. Is the patient experiencing any life-threatening condition? I'm going to select no. Then the next one says, is the patient at high risk of deterioration or in severe pain or distress? I'm going to select yes, and boom, ESI 2. Again, I'm going to reset it. We'll go back to the 20-day-year-old child. This time I'm going to select no on both. And then when I do that, these things pop up, your resources. You got labs, imaging, IV fluids, medications, specialists, consultations, ECG, Foley. So I'm just going to select a few lab tests and let's do a Foley and I'll hit next. Now it's going to ask you for your vital signs. So I'm going to put the vital signs. So for a 20-day-old, I'm going to put the heart rate at 60 and I'm going to put it at 50. And in the respiratory rate, we're going to do 10. O2 sats, we're going to do 80. And the blood pressure, we're going to do 40 over 20. I know these are all normal, but I want to show you what I did for it. So when you hit next, it's going to show you that the heart rate and O2 sats are low. Now I'm going to go back and work on this because 15 breaths a minute is also low. And so I guess I'll have to tweak my tool a little bit, but 15 is also low and 40/20 is also low. But what I did down here was I made it where if the vital signs were abnormal, not only would it show red here, but it would show you abnormal down here. And then when you click on determine ESI level, it's going to go that it's a 2 because of the vital signs. All right. So if you're not sure, I have this walkthrough end user down here and just walk through and fill this out. But I'll go back and tweak the vital signs a little bit to make sure that the vital signs are correct. So it will make sure it signifies you. I don't want you focusing on vital signs, but I don't want you miss important vital signs either, because that could be a problem with you. So this is a great tool that you can use, and I encourage you to use it. After you do your initial pediatric assessment, conducting an initial assessment of the pediatric patient in the ED is a critical step. It's going to keep you from missing shit. Look at the chief complaint. Begin by obtaining a clear and concise account of the child's complaint or the parent's complaint. Ask about the onset, the duration, the severity of the symptoms. Assess your symptoms. Are they having pain? And so you got to think about the different pain tools. So we're going to use FLAC for infants. For children like 8 and older, you'll use the Wong-Baker's faces or the number scales. Neonates, you'll use the NIPS, the NIPS score. Look at their fever. Are they having any fevers? Are they having any gastrointestinal symptoms like vomiting, diarrhea? Look at the vital signs. So inside the chart, inside your ebook, I did put the normal vital signs, the heart rate, the respiratory rate, things like that. Inside the blood pressure, put your blood pressure, your physical exams. And then I put in here about respiratory distress, shock, altered mental status. So there's a lot of good information when it comes to when you're doing your initial assessment. So then again, when you're doing your pediatric assessment algorithm for your ESI rhythm, I have in here, just like on my tool, step 1, step 2, and it just keeps going through. I even have a diagram in here that will show you how to run through your ESI triage level. All right. So when it comes to pediatric patients, so let me give you some examples here. You got a 3-year-old boy. His chief complaint is vomiting, diarrhea for 24 hours. He comes in, he's lethargic, but when you try to wake him up, he is irritable. He's got decreased urine output, dry mucous membranes, sunken eyes, and decreased skin turgor. Vital signs, the heart rate is 140. Respiratory rates, 28 breaths a minute. Blood pressure is 90/55. He's got dry mucous membranes and sunken eyes, decreased skin turgor, lethargy, and irritability. This one would be constituted as ESI 3 if his vital signs are stable. It'd be ESI 2 if his vital signs weren't stable. But what are the interventions? You want to make sure you administer IV fluids, normal saline to rehydrate. And because he's a 3-year-old child, you'll do 20 milliliters per kilogram of isotonic crystalloid solutions. You want to make sure you assess his electrolytes and replace them as necessary. You may perform some blood tests. You may get a sample of the stool to see if he has any type of gastroenteritis or other problems. Maybe use some anti-medications to control the vomiting. And you want to make sure that your outcome, the child has significant improvement in hydration status, because you don't want them to go into hypovolemic shock. All right, so like an ESI 4. 4-year-old girl, chief complaint, she fell off a swing and injured her arm. She's crying and holding her arm, swelling and deformity of her forearm, mild pain, but no signs of distress. Her blood pressure is 100/40. Heart rate is 100. Respiration is 22. O2 sats are 99%. You can see some visible swelling and deformity of the left arm. Tenderness to palpation over the fracture, but no neurovascular compromise. So it's ESI 4 because you're going to need some x-rays, you're going to need some splinting, maybe some PO, Tylenol, and an education and an orthopedic consult. So, that's a ESI 4. Could be even ESI 3, depending on the type of consult. So again, I encourage you to try to use these tools, because we're very terrible at triaging patients. And sometimes our triages don't work very well because we're using our emotion and not the tools at hand that we need to use and stuff. All right. So again, I encourage you to download the ebook. Again, I encourage you to listen to this episode. Go onto the website, morethancpr.com/pediatric-ed-triage. And by the time you listen to this and the episode is out, I will have the vital signs fixed. And on the website, there's a help section. There's some feedback. So, don't be afraid to give us some feedback. That would be great if you could help us provide with feedback. If you like it, great. If you don't, then don't fucking use it. I'm just trying to help make a difference in the ED when it comes to pediatric patients and all of our patients, because I do care about my patients as well as yours. All right. We may do an extra episode this week because there is a story that came out recently that I wanted to talk about. It is a patient. Fatal delay. Federal probe reveals that Vallejo man died at Kaiser ER after an 8-hour wait for chest pain. And this happened, the story came out on July 13, 2024. So this is something that we're going to talk about in maybe a special episode that will add extra to this week's episodes. All right. So I appreciate you guys. I hope that you listen to this, a comprehensive guide for the healthcare professionals for the Pediatric ESI Triage. All right, bitches, I hope you had a good day, and I'll see you next time. And look out for this story about the patient who died in the ED. And then after that, we're going to work on neuro, work from head to toe. All right, bitches, peace. I love you, motherfuckers. Stay safe.
Don't miss out. Engage with us weekly. Share your thoughts, and let's transform the nursing landscape together.